First of all, I'd like to ask your permission to use this interview for educational purpose and on the internet.
Yes.
When was our surgery?
Our surgery was December 24th, 2020.
So about 6 months ago.
Yes.
And this is what we did. We did a L4-5 OLLIF, minimal invasive fusion, in a, and put 4 screws and 1 spacer, 2 rods. And this surgery was done in 36 minutes with less than 2 ounces of blood loss. And you went home after the surgery when?
It was maybe 4 hours after surgery.
4 hours after the surgery. Now, these are important, these numbers are important because you were told for 8 years is nothing wrong with you.
Correct.
Tell me about it. What was going on, and what did you hear in that 8 years?
I went to multiple doctors and they basically said that there was nothing wrong, that everything was fine, that to push it off, and it would get better, do physical therapy, it'd get better. Well, it never did.
Never did. Now, how was that 8 years? 1 to 10, how bad was the pain?
It started out as a 4 and started working its way higher from there.
Okay, just before the surgery, 1 to 10, how bad was the pain?
Before the surgery, it would get up to an 8 or 9.
8 or 9, both in the back and the legs?
Yes.
Where was the leg pain before the surgery?
The leg pain before the surgery went down the back side of my leg, on the top side, crossed over to my kneecap, and then straight down, and then all the way down to my
Typical
big toes.
L4 and L5 nerve root irritation, which is truly correspond to the level that you had the pain. So we could put the information together, and then finally 6 months ago we did a half an hour, practically 36-minute half an hour surgery, day surgery. How is the pain now?
The pain's gone.
When did the pain in the leg go away?
The pain in the leg went away right after surgery.
Right
I didn't
after
notice
surgery.
it at all.
Yeah. And so it wasn't in your head. The pain
Right.
was not in your head
Right.
because we didn't do anything to your head. We fixed your back.
Yep.
So the pain was all along in your lower back, even though you have been told there's not much wrong with it and you just have to live with that and so on. And you didn't have to live with that.
Right.
Because if you had to live with that, a 36-minute procedure with 2 ounces of blood loss, 2 spoonfuls of blood loss, couldn't fix the problem. And unfortunately, this is a common problem that we tell our patient, go live with it, nothing wrong with that, because sometimes we don't bother to look carefully.
Right.
So you were right. It was something wrong with your back. And unfortunately, many of my colleagues were wrong. And now, the back pain, how bad is the back pain now?
The back pain is 0.
0, okay. Now, are you back to basic daily activity and do things that you like to do?
Yep. I'm back to pretty much everything that I can do that I want to do.
Yeah.
Except for like heavy lifting or jumping around.
Yeah,
or anything like that.
No, we don't want you to jump
Well,
around.
no longer than that.
Yeah. Now, if you knew what you know now, and you go back in time 5 years, what would you tell yourself, and what would you tell people like me that's sitting on the chair and you're trying to get help from them? If you knew what you know now 5 years ago, what would be different?
To be honest with you, I would have told myself to come to Inspired Spine because they actually listen to you and take in consideration that there is something wrong.
Yeah.
Nobody knows themselves better than themselves.
Yeah, it's inside of you. You feel it.
Exactly.
Now, what would you tell to my colleagues that, told you just live with it? What would you tell them, knowing what you know now?
I would tell them, you need to look harder. You need to figure out what's
Don't give
going
up.
on.
Yeah. You have to put them on the spot.
Right.
This is your body. You have to live with that. You have to live with that in the night. They don't. We don't. So you have to put you have to hold us accountable. I think that's a very good lecture for people who are in this situation, not to give up and to look further and ask questions and look around.
Correct.
Well, any other comment, question? No? Okay, well, thank you so much for the interview. I appreciate that.